Hi, I'm Dr. Julie Steinhauer. Today I want to talk to you about a topic that we have been getting a lot of questions about, which is jaw problems or dental work and visual problems that come about afterwards. Now, this is a hot topic. I say a hot topic because a lot of people experience this and they never really put two and two together. So first of all, though, if you'd like to contact our clinic in your local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can do two things. You can either click on this questionnaire, fill that out. You can get some answers as to maybe you're not knowing like what's going on with you visually, and it will start a sequence of emailing with us, as well as you also have the opportunity to click on the schedule a consultation button where you can schedule a video consultation with me direct, and we can talk about how we might be able to help you. Now let's go back and talk about like dental work, jaw issues, and how it can affect your vision and why people sometimes will have issues. Now, sometimes this can occur after a person is had braces, taken their braces off. It can occur if someone's had, some dental work, like, maybe it's been some bridge work or something like a root canal. There's a ton of different dental procedures that can have some sort of bearing on not only, obviously, jaw, but alignment with the spine, and then it can affect vision. And most people, are just so unaware of this. They don't really understand, especially if someone has like a malocclusion or an incorrect bite. Whenever they're chewing and when they're talking, or where they hold their position of rest with their mouth, if they're sleeping and they clench, all of those things actually it's not just about dental and jaw and mouth, but it can affect your vision. A lot of those patients can develop vertical imbalances of the eyes called a hypertropia. Sometimes it might be not a true misalignment of the eyes, but like a positioning when you're doing certain tasks called a hyperphoria. It also can cause another form of strabismus, which would be maybe like an esotropia or an inward eye turn. Every now and then we see something called an exotropia, which would be outward eye turn associated with these things as well. So you want to be kind of, if you've ever had any kind of dental work done, either maybe you're in the process of having braces on and you've noticed some changes with your vision. It's possible because of readapting and moving the jaw around and changing the structure of alignment that it can cause some issues. Now, this in no way says don't do these procedures. It's in no way a knock towards dentistry at all. Obviously, that stuff is all required. It's really important that you do a lot of those things. But what we're saying is, gosh, if you've had those things done and you're wondering like, what the heck happened with my vision? This is explaining, well, here's what happened with your vision. It can cause misalignment of the eyes, inward, outward, up and down, and it can affect the alignment of the eyes, which might throw off your cervical spine or your neck. Kind of things might be kind of unlevel, like the cervical vertebrae can kind of get mispositioned. They can rotate. There's all kinds of things that can kind of happen with that. The jaw can slip out of joint or clack and cause problems as they're changing like positioning of your bite. It affects everything to do. Also, we've got to talk, there's muscles involved, muscles that go through the face and connect, the jaw, connect to the back of the head. There's muscle structure that goes all through here, have different connecting points, and that muscle structure, as well as there are lots of nerves that run from the brain into the facial region, and they're all kind of tightly bound together back in the brain area. So if you have something that occurs with dental work, it can affect and exacerbate something with vision, obviously with cervical spine. So there's like a big interconnected web with all of that. And this video is really designed to just help you understand, wow, I never knew it was so interweaved and connected. Now, if you have had visual problems that's resulted from some of the work that you've gone through, please realize that there's actually help for that.
So when our clinic, we do two parts. We do an electrical component where we're kind of triggering the brain and the muscles and the nerves to change something vision-wise by using syntonics or light therapy goggles, which we've talked about. We also come alongside with more mechanical types of treatment, which is vision therapy, and it's about teaching you how to kind of track and focus and align and use your two eyes together as a team. And oftentimes we will pull in a person who can kind of help with like that spinal manipulation. So chiropractic care is really helpful at the same time that you're going through syntonics and vision therapy. Again, electrical stimulation and a more motor or mechanical type of treatment with vision therapy. And then a more motor type of adjustment. I shouldn't say that. My chiropractor friends might be upset with me on that one, but there is a component of motor adjustment that occurs with the spinal manipulation. And it's all about making sure that we've got proper alignment, proper blood flow, which allows for proper nerve supply, not only to the face for jaw and alignment here, the spine, which not only aligns the head, the neck, but the whole body. And if try walking around with like a pinched nerve and you're like, oh man, it's so bad. It's impeding the blood flow all down my left side of my body. You'll want to get help for that, right? And obviously all, nerve conductivity that's going on with inside of your brain, skull area, sending out information to your entire body. We just tend to think like this vision stuff, it's just these eyeballs right here. But you're connected to an entire system that's neurologically based. And so we want to treat it as such. Now, if you're saying like, oh my gosh, this is craziness, I never thought about this before. But you know what? I have that problem. Then if that's you, contact us. If you're local, you can call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can fill out a questionnaire or schedule a consultation direct with me online so you can hear about what we have to say about how we can maybe particularly help your situation or someone that you know. Now, if you feel that you should pass this on, we would love it. Hit the like button, and if you haven't done so, subscribe to our YouTube channel, but make sure you hit that bell icon with all so you get all notifications of the videos that we put out, because they're awesome. And you never know, you might be watching it just because you're a fan, but you might find something that could be beneficial to you or your family or someone that you know. Thank you.